Have you ever slept 8 hours, put on concealer, and still looked exhausted? That feeling when you look in the mirror and think, why do my eyes look so old? That's not a makeup problem. It's not even a skincare problem. It's a structural aging problem, and most people are treating it the wrong way. Today, I'm going to explain why under eyes age, what's exactly happening underneath the skin, and exactly how dermatologists decide between filler, fat, growth factors, laser, surgery, different options. So you can stop guessing and finally fix the right problem. But listen closely. If you don't know things right, then you can make the problem even worse. So listen to my talk. I'm Dr. Morgana Colombo, board certified dermatologist, and let's get into what happens under eyes. So the under eye area is the most vulnerable area of your face. The skin here is thinner, weaker, lower in oil glands, sits directly over muscle, fat, veins, and bone. So when aging starts, everything shows. So basically thin skin, guys, with no glands. And here's the most important thing to understand. Under eye aging is not just one problem. There are four main processes happening, and most people have more than one of these processes at a time. That's why one treatment rarely fixes everything. Now, let's talk about those four processes that lead to under eye aging. So first one, hollowness. So what's happening biologically there's bone loss around the eye socket, fat pad descent, and loss of collagen support. So this creates a sunken, skeletal, tired look, even when you're well rested. And concealer doesn't really help that much. Best treatments for that are gonna be filler, deep injections, conservative, fat transfer, growth factors, but that's experimental, PDGF, with the goal of improving skin quality and promoting collagen. Important to keep in mind that this area is very unforgiving. Poor filler technique can cause puffiness, migration, and a weird color there. But you have to address that hollowness. Is critical to improve that. Going back to the fat graft, I want to mention that it's slightly invasive of a process. You have to go through liposuction to then harvest the fat. So a lot of people are not interested in that. The next thing that ages your under eye area are wrinkles and crepey skin. So what's happening biologically? There's collagen breakdown. There's also muscle movement, constant blinking, and the orbicularis muscle moving creates lines, and estrogen loss after 40. These leads to those fine lines, texture, and crepey skin that you see, especially when smiling. Best treatments for that are going to be laser resurfacing, CO2, erbium, ultra clear laser, retinol to promote collagen, and then some of those regenerative treatments such as PDGF, exosomes, PRP or PRF, but those are, kind of like experimental. Botox will help with the crow's feet laterally, but doesn't do a whole lot under the eye area. That's more of a skin quality issue there, creating the crepiness versus a muscle movement problem. The third issue that happens and makes your under eyes look aged is under eye bags, fat protrusion. But what's happening? So there is herniation of your orbital fat as you get older and weakening of the orbital septum. So the ligaments get weaker and the area puffs out. So the hard truth is that creams are not gonna fix this. Your best treatment for the herniated fat pads and those under eye bags is gonna be surgery, lower blepharoplasty. The new laser, ultra clear, which allows you to do some coring, which microcuts the skin, can help in a mild case, but for majority of the cases, surgery is the way to fix this. The fourth thing that leads to under eye aging, and the most misunderstood one, are your dark circles. Dark circles are not just one thing. There are three different causes. One, thin skin and visible veins. So in order to address that, you have to use vascular or pigment targeting lasers. Keep in mind that lasers can be slightly dangerous under the eyes. And vein stripping is another option. Pigment is your number 2 cause, discoloration, brown discoloration. So you want to address with lightening creams that have arbutin, vitamin C, kojic acid, hydroquinone. And then the other issue is volume. So you have volume loss, which causes like dark shadowing of the area. And that's, again, a volume issue. So you have to address that with what I talked about earlier, fillers, fat, and maybe some growth factors. So a lot of people assume that dark can just be treated with like a cream, but again, dark circles, different causes, so keep that in mind. And that's why a lot of people actually fail in treating their dark circles. We talked about the 4 different things that cause under eye aging, but how do dermatologists decide what you need? So the decision usually is related to those 4 things. So if you have sunken under eye areas, usually filler, fat, or, biostimulation. If you're wrinkled, resurfacing, and collagen repair. If you're puffy, under eye bags, surgery. Dark, you want to identify if it's pigment, vein, or shadow and address that. Best results come from, multi-treatment approach, not chasing weird trends that are out there. So for most patients over 40, the best under eye results are going to come from a combination strategy. Improve your skin quality first. That involves lasers, creams with retinol, then structural support if needed, fillers, fat, surgery if you have protruding eye bags, and lastly, if you have dark circles, target veins or pigment as needed. There's not one universal fix for under eye aging. The plan varies based on the person. It's individual therapy, guys, but keep those 4 elements in mind. Those are the 4 things that make your under eye look darker. But let's say you don't want to do anything. You just want to hide it. And I have here my secret product that I use to hiding, your under eye issues and improving it. It's the Color Science Total Eye Renewal Treatment. It's a sunscreen, a concealer, and a moisturizer, all in one. Great product. So if your under eyes make you look older, more tired than you feel, you're not imagining it. You're not failing at skincare. You just need the right diagnosis. And I'd like to mention that my Vidaderma line has some great products to address the under eye area. Our eye neck complex has growth factors, retinol, one that doesn't irritate, some antioxidants, moisturizing agents, all to improve your under eye skin integrity. And we also have the Eye Refiner Duo, which is interesting. It has the same things as our eye neck complex in one tube, and then another tube that has this mild acid TCA, which gives you this exfoliation, so good for like deeper wrinkles there. And then lastly, we have our Eye Refresher Gel, which is just a moisturizing hyaluronic gel with peptides, which makes the area look, refreshed, hydrated. The peptide there is almost like a Botox-like peptide, so temporarily helps the appearance of wrinkles under the eyes. If you want me to continue producing videos that help you as you go through your aging process, subscribe and help us grow our channel. Thank you. See you in the next video.